Hello, future nurses. Thanks for joining me today. Today we're going to take a gentle journey through the components of the Mental Status Examination, or MSE, and the Suicide Assessment. These are essential tools in mental health care, and understanding them will help you provide compassionate and effective care to your patients. Let's start with the Mental Status Examination. The MSE is like a snapshot of a patient's psychological functioning at a specific point in time. It includes several components. Appearance. Observe the patient's physical appearance. Are they well-groomed or disheveled? For example, a patient who is unkempt may be experiencing depression. Behavior. Look at their behavior. Are they agitated, calm, or unusually still? For instance, a patient who is pacing may be anxious. Speech. Listen to how they speak. Is their speech rapid, slow, or slurred? A patient with rapid speech may be experiencing mania. Mood and affect. Ask about their mood and observe their affect. Mood is the patient's sustained emotional state, while affect is the observable expression of emotion. A patient might say they feel down, mood, and appear tearful, affect. Thought process. Assess how they think. Are their thoughts organized or disorganized? A patient with schizophrenia might have disorganized thoughts. Thought content. Explore what they're thinking about. Are there any delusions or hallucinations? For example, a patient might believe they have special powers, delusion. Cognition. Evaluate their cognitive function. This includes orientation to time, space, and person, attention, memory, and abstract thinking. You might ask, what year is it, to assess orientation? Insight and judgment. Determine their insight and judgment. Do they understand their condition, and can they make sound decisions? A patient with poor insight may not recognize that they have a mental health issue. Now let's move on to suicide assessment. This is a critical part of ensuring patient safety. Here are the key components. Ideation. Ask if they are having any thoughts of harming themselves. For example, have you had any thoughts of ending your life? Inquire if they have a specific plan. Do you have a plan for how you would harm yourself? Means. Determine if they have the means to carry out their plan. Do you have access to the tools you mentioned? Intent. Assess their intent. Do you intend to act on these thoughts? Protective factors. Identify any protective factors. What keeps you going? What are the reasons that you choose to live? Remember, your role is to listen with empathy and without judgment. Now you know the components of mental health examination and suicide assessment.